Hello, welcome everyone to another Me, Myself, Help and I podcast. I am so excited today to have one of my friends, a doctor who is a pediatric dentist from India. And yeah, she's been an inspiration for a lot of us. We'll go into a lot of things, but thank you and welcome Dr. Parvathy Vijay to our little space in the internet. Welcome.
Thank you very much. So I'm going to address you as Nikhil Chat itself because that's how you are me.
Yeah, we can have a debate about Chetan and stuff, but it's okay. Yeah, whatever makes you comfortable, is fine. So yeah, how are you doing?
Great. For the past 1 week, great.
Why is that? Why is that? Past 1 week, what happened?
No, there are ups and downs sometimes, but then you have to deal with it. So I deal with it in my ways. Healing is always like that. It's not like once you're healed, you're fully healed for forever. You have to keep revisiting your lessons. We have to keep redoing revisions. So that keeps you on the road.
That's good. So, would you like to share a little bit about your story? So, who were you? Who are you? Why you do the things you do? And how did you become a doctor?
Yep. So, I come from a normal middle-class family, okay? We were in the Gulf. And then after that, we got settled in India and have been a troubled child all through my childhood. I'm born between two brothers. So I have an elder brother and a younger brother. So typically a tomboy. So tomboys are generally not welcome anywhere. But then I have a very supportive mother who accepts me just as I am now, but not before. Okay. We have had lots of ups and downs in how things were and everything. And then I settled in India. Okay. And I went into learning my degree, which is BDS. I'm a dentist. After which I did my post-graduation, which is in pediatric dentistry. So So initially itself, I was a troubled child. I had gone through my share of personal losses, personal sufferings and everything. And it has been going on from probably 14 to 15 years of age from that time onwards, getting into toxic relationships where only later on I identified that I also had toxic traits in myself. Okay. And then after that, I got into my post-graduation and, education part and all that. There are also a lot of personal struggles, a lot of issues, certain diagnoses which really affected me about my mental health. Because one thing is accepting that you have a particular issue, okay? And when you accept it, you have to also accept its pros and cons, okay? There are both. And you have to accept that and then learn yourself. My learning about myself actually only started in 2020.
Okay.
Learning about myself. That is learning about how bad an individual I was, how toxic I am, what is my capacity of destruction. Okay, all that I only realized in 2020. So it's from then that I started understanding myself. I learned my patterns. I learned my own pitfalls. I learned everything about myself. Every small thing. I know what can trigger me. I know what can mellow me down. I know what I should do when I'm in distress. All that. And one thing which actually helped me along the way, which was something which I started very randomly. Okay. I was in therapy from 2020. I was in therapy and it's actually my therapist, Dr. Zaileshia Mitra, from Mitra Clinic, who actually helped me understand myself, who actually pointed a finger at me telling, Parvathy, that's your toxic trait. That you are the person who's at fault. You have to address your issues. And I understood the importance of accountability. Like, we have to be accountable for ourselves. We have to take accountability. And that's when I realized. So initially, there were these struggles. Your ego gets hurt when a therapist tells you that, you're the person who's having a problem. Yeah. It really hits you bad. There are fights that you have, okay? There are days I have come back from therapy telling, who is she to tell me this and all that? But then the biggest advantage or the biggest quality I see in myself is I'm willing to learn. I'm willing to unlearn and learn and relearn. Okay. So
just on that learning, unlearning and relearning, is that something you picked up along the, because that is often where people start to change. But my question to you is like, was that something, were you always learning, unlearning, relearning?
It is something I initially picked up from a therapy session, okay? Because that was where it started. That is addressing the toxic traits, addressing. So my escaping, I'm an escapist, okay? When I get into trouble, my escaping technique is just run away from that situation. I completely avoid the situation. I cannot confront the people involved. I cannot confront the individuals involved. I don't know how to communicate with the people involved, okay? Those skills I learned from a therapist. Like, she taught me a certain way of talking, okay? She taught me certain techniques about how I can communicate, and it's okay to communicate. It's okay to say no, okay? And it's okay to understand your value and put yourself out in the world. And also an important thing that I learned from my therapist is not everybody deserves your story. Why I specify that is because a certain amount of crowd or a certain population do not want to hear your story for understanding you or learning from you. It's just for judging you. Okay. So you tell your story to people who will learn from it, or will get help from it. So I was an open book. I was an extrovert. Okay, but I have learned what information is okay to share, what information is not okay to share, what part of my journey should I talk about, what part of my journey is for myself. Okay, it's the same for every individual. So all this I learned from therapy. But I also had a very, very bad incident between all my therapy years, where it really broke me down, where, it pushed me to the verge of suicide also. And there was a time where I was also admitted in the hospital without any sense of knowledge for about 1 week time. Okay. After that, I slowly started coming back to myself. Okay. Then somehow I stopped therapy, because I started, like, you have this thing where you associate a smell to an incident, you associate a picture to an incident, okay?
Yeah.
All that. So for me, after I came out of that whole situation, when I think about therapy, I go back to all those sufferings, okay? So I understood that I cannot depend on therapy or, medicines all my life. I have to find my own way through my life, navigate myself through it, and learn, unlearn, relearn in my own way. Okay? That's when something interesting happened. That is, casually, my elder brother got married, okay, and I have a very wonderful sister-in-law. She was a very enthusiast of, health. Like, she loved fitness, she loved going to the gym and all that. And that's when she casually told me, hey, Paru, probably you should try gym. Okay.
Okay, hold on. I think, hold on. We will go into that in the detail. I just want to, don't want to break it yet. Let's come back to this, like the things you just mentioned, because this is so powerful coming from a doctor. I don't think doctors are this open. So I'm really grateful and thankful that you are sharing your personal story in terms of suicidal ideation and like therapy. How can we as a society change this perception of therapy being something you do only when you are ill. So there is this mentality, especially in South Asian culture, in our culture, that if you speak to a therapist, that means you are
not
crazy, is what the official term is. And for me also, therapy has helped tremendously. I advise that. I mean, I am a therapist also. I am a psychologist. I do meditation and all the stuff which we talk about. I'm a life coach. All of that is because I went to therapy. I went and sought out help at my lowest point. And my idea is people don't need to feel at their lowest to then go to get help.
Exactly.
And then leave the therapy and then again go back. So the cycle, how do we make it as simple as, like I often use this example, brushing your teeth. Therapy should be something like brushing your teeth. Also, I will also say therapy is not accessible for a lot of population because of socioeconomic divide. So I understand that. But this is for people who already have all the socioeconomic, all the wealth in the world, but yet they're mentally not there, and they don't ask for help because it's kind of beneath them somewhere. So, like, how do you address that? As a doctor and as a person, how do you address that challenge?
So, for me myself, I have also gone to therapy only at my lowest. Okay. I was recommended there through someone else. Okay. And I went there like that without even knowing anything. But can I tell you, only the first probably 1 or 2 months was about addressing the part of my toxic traits or my diagnosis and everything. Rest, everything has been about how I can be better. I mean, who wouldn't take that? And I was like, my God, people are not understanding therapy. Like, she did not need to teach me about assertive way of talking. She did not need to teach me about communication style. She did not have to teach me about grit. Okay? She did not have to teach me about how you can be confident in yourself. Okay? These all things I learned from therapy. And that is why it's very important for everyone, like, how you can be better in your work life, in your professional life, in your personal life, how your interpersonal relationship is going to change if you learn certain communication styles. Okay, if you learn about other people's language. Okay, I'm not talking about the literal word language, but so that's what therapy has done for me. Like I told you, the diagnosis part and the treatment part was probably just 1 or 2 months. After that, it was all about how I can be better every single day. And to date, I practice it. Like, all the techniques that she has taught me, like when anxiety hits, for me still anxiety hits. But when anxiety hits, I know the 5 things that I do, sense, smell, all that. But other than that,
okay, can you explain that? That will be very important. So when anxiety hits, what do you do?
So when anxiety hits, the first thing that we have to do is, if you're in a room and this is happening, you look at the details in the room. Okay, let's say I'm going to give an example. Let's say this bag. Okay, so this bag has how many elephants? You count the elephants. You'll see the designs in the elephants. Okay, and change your vision. That is, change your vision means if you are stuck in a room, get up and walk out of the room. Go to a place where there are a lot of people. Okay, then change the sense. That is, sensations is what we have to change for getting your anxiety under control. Sensations. So which means sprinkle water, not even splash water. Okay, we have to sprinkle just droplets of water on our face and always carry a soothing smell. Like I always have my hand perfumes in hand.
Okay.
So you change the sense of smell. These are the first to go to when your anxiety hits out of nowhere. So it can hit any time. For me, you wouldn't believe the weirdest things causes it for me. Like let's say I'm sleeping on the bed at night, the sound of the fan. Okay, it can trigger an anxiety for me. the washing machine, which is, very, very far off. A normal person wouldn't even notice the sound of that, but I would notice the sound of it, and that would trigger the anxiety. So it is the weirdest and the smallest things which can cause an anxiety attack. And in that moment, there is also a breathing technique which we can do, which is 2 inhales and 1 exhale.
Yeah.
That also helps a lot. This is how I address my anxiety. Now the intensity has reduced a lot. I only get it probably once in 3 or 4 months. That is because of my gymming.
That we'll come into that separately. There's a lot of things we can unpack there. But yeah, that's a very interesting way you put it. So for me, I think so you talked about grit, you talked about like the positive changes of therapy, you talked about it's not about exploring and like I think people are scared of therapy. They're scared because they don't know what they're going to see. Yeah. And for a lot of people, especially in our culture, come back to Kerala and people, Malayalis in general, there's a lot of, I want to say trauma with a small t. There's a lot of trauma which is in the society, which is not addressed. There is a lot of childhood developmental issues. There's a lot of
cultural conditioning. A lot.
I mean, a lot of cultures have it, but because we grew up in that environment, I see it a lot. And the reason people are afraid or they feel like there is this scariness to therapy because of it's a conditioning. It's because we see movies, we get that image of certain people going into a mental hospital. We've been conditioned in that way, like, oh, these people need to go to this place. They're not part of the society. And this neurodiversity is what is the literature is. It's neurodiverse. People are different. And that's okay. Yes. And that understanding is the reason I think people feel like, oh, I believe this is the way life should be. And then if it gets challenged, then, oh, they're wrong. So a lot of these mental health conditions goes undiagnosed. And for me, it's personal because I went through anxiety, depression, bounce back, and still certain symptoms started occurring. Now I have been diagnosed with AVPD, which is avoidant personality disorder, and some sort of borderline personality. And also I have all the traits of inattentive ADD and in adults. So there's so many things which are coming to me from learning, from talking, from exploring, from speaking to people about mental health, that so many things are unearthed. And people say like, oh, it's better you don't know. Ignorance is bliss. I disagree completely. Ignorance is not bliss. Awareness is bliss. So get aware so that you can take these steps. So like, for example, you talked about anxiety perfectly, in a sense for you. Like you see it what it is. You saw anxiety. You learned what it is. And then you took action. You said accountability. And that is coming from somebody there to support you. And I hope this conversation gets to the right people, and like, just speak to a therapist, speak to someone. I know, therapy also, there's a lot of misinformation out there, and what therapy is and what therapy isn't, but still taking that first step, finding your healthcare provider, and like speaking to a doctor like yourself, just get in the conversation can help, right? So let's move on from your story, and now I would like to come closer to your profession. So why did you want to become a doctor, or is that still your passion?
It is still my passion, and I love it with every minute, every second of my life. So I told you about the lowest point of my life, right? So even during the lowest point of my life, okay, what I understood about myself was, however bad I have been, let's just imagine I have been screaming with at the top of my lungs for the past 3 to 4 hours, okay, but I go into a clinic like nothing has ever happened, and I could treat children. And you wouldn't believe that switch, okay, which would happen inside me was like magic. And like I could treat children with the same love, with the same care which I would give even normally. So that's when I understood that this is a tool also for me, which by my profession was also a tool for me, to, what do you say, unwire myself. Like, see, I agree that some people have, keep job as job, okay, and passion as passion. But I'm blessed. I'm one of the few blessed who still has job and passion as one. Okay. I love children, and there's a reason why I chose pediatric dentistry. So pediatric, like the name suggests, children. So even if they're going to come to me for a small dental issue, I can still understand their psychology. Okay. I can already predict how the child is going to be, what kind of personality the child is going to develop. Okay. And what kind of parenting the parents are having. I can guide them. I can guide them, telling that if you're going to continue this, you're going to be, you're causing more harm to your child. You cannot be overprotective about your child. The parenting styles.
Yes.
I have a.
I have a question there. I have a big question. I as a child, I used to hate dentists. No offense. I mean, it used to be the most, like, I don't know what it is. It used to be the noises in the dentist room, as you said, the tactile sensations, the chloroform or whatever, that thing which you put in the mouth. I haven't gone to a dentist in a while. You might know this is old school where they had that chair and like it was such a difficult environment as a kid. So I developed this like fear of dentist as a coping mechanism. So I never complained about my toothaches to my parents, or like I used to hide it, and like anytime I wanted to, like, I would escape. And then that carried on into adulthood because I was afraid of going to dentist, oral hygiene and things like that. I still learn it, but I'm not actively. I think there's still stuff in my teeth which are because of I still have a wisdom tooth. But and I've lost a tooth because of my excessive consumption of sugary stuff. Anyway, so the point is, how do you make it so that kids don't have that experience?
So the important thing is that understanding the child. Okay, every child is different. I have been in this practice for almost 8 to 9 years now, but no two children are the same. Okay, so I give that to them. And I cannot treat children like how they were treated so many years back, where they were not given information about themselves. That's how we were treated. That's how I was treated. Okay, I was just taken to a dentist. Doctor, do whatever you want. I was not explained anything. But I don't do that. I consider even a 3 or a 4-year-old as an individual. So when the parents tell me, ma'am, you please do whatever you want, what I do is I explain it to the child. I want to do this and this to your teeth. They have the right to information. I agree that they are children, but they have the right to know what is happening to their mouth. So that's the one thing which I developed, which was not taught in my school, which is not taught in my dentistry. Okay, which is something I learned along the course, where, I have to treat them like an individual. And I always make it a point, if the child is hurt, okay, like when any procedure I did hurt the child, I always make it a point to apologize to the child. Okay, it is very important that you treat them with the same respect you treat an adult also.
Yeah, I don't think I've ever received an apology from an adult, ever. Even now.
It is very, very, very important. And I also hold them accountable. That is, if they are not going to behave properly in the scenario, I make it a point they also apologize to whoever they have hurt. Say the child starts kicking the mother in front of me. Okay. So that also I do. And why the child is doing that is because of the parenting style. Yeah. So I hold them accountable.
Fascinating.
As well as I also take accountability.
I mean, that is so refreshing to hear. Like, I can go back to my childhood, going to see doctor. Yes, there were some fantastic doctors, and like amazing. Like, doctors are held at such a high regard in our society that there is this air of whatever they say is like gold dust. We just take off every word. We just take like whatever they say is right and things, and we never question, we never challenge, we never learn. And what I felt, this is my personal opinion, I don't know what you think, I think doctors especially are less, now that there is a lot of information out there, people can find things for themselves, which is good and bad. We can debate about that, but still people are more aware. They're starting to understand that the things which doctors did in the past are not working. There is new ways. There is different ways to approach, and not treating people as patients and things to fix. There is different approaches. So what are your take on how doctors, are doctors capable of doing that from where they come from? So like I don't know what they're taught, because my sister is a doctor, so I know a little bit. I don't know too much. How are you seeing this? Is there a change in how doctors view
it's a little people? Weird, because I'll tell you why. So I am coming from a background where I'm still willing to learn, unlearn, relearn. And it goes for my patients. I mean, it goes for my children also, my patients also. I wouldn't say not, let's say probably, there are still people who be in the old school of thought, okay, where they don't think that, they would be held accountable or things like that. Okay. It's a very weird space. But I also know doctors who are so good, okay, who consider the person, who wouldn't just treat a kidney or liver, okay, a stomach.
Even the tooth is connected with a lot of nerves, right? It's like...
Yeah. That's what. So who would consider looking at them as a human being who's going through suffering? Understood. So that's what I like to do. That is, even if they are going to come to me for an issue with the teeth, I would always make it a point to ask about their general health, okay? Even mental health. Like, I also have a patient who came to me with a tooth which was fallen off. I fixed it back and all that, but he ended up being the closest patient because he had anxiety issue. I could identify his anxiety disorder. I could help him go to the doctor for it. And to date, he is very, very, very grateful to me for identifying his anxiety issue. Like, I could say the same things that he would feel. And he was like, "Doctor, how is it that you're telling this?" And it's because I have gone through the same thing. And I also feel it's important that, they know that you're also human who goes through these same set of emotions. It's very, very... You see, you can only talk to someone who you feel relatable to. You cannot talk to a professional person who is only doing a work and who only goes to conferences. I make it a point that I let my patients know if I'm going on a holiday, if I'm not well, okay, if I'm going to take a break, okay, then they will also feel like telling me if they are going through something. But it's a weird space where I wouldn't agree that all have changed. It's a little tricky there.
I mean, we don't have
Probably.
everybody to change. Like, it's the critical mass. We have to get enough people to start to change. I don't know. I have not again seen a dentist in ages. You're the first one I'm seeing. Like, and we are not even talking about dentistry. But I think there is a lot the doctors who do a wonderful job, right? That they help humanity. They do a wonderful job. They sometimes get stuck in this belief perseverance. So they believe something and they just persevere with that. They're like, this is the belief, this is it. Like, this is you have certain condition, just do this, not to take into account other factors like environment, genetics, so many things.
Exactly.
So I have like utmost respect for all the people who work in the space, and I also feel there's a gap. There's like that relationship between a person and their doctor is a sacred one, because they can literally save your life. They can literally save your life. Yeah, you were saying.
But I told you, it's a little weird equation now. So the reason why it's weird, I'll let you know. Like, see, before, like how you said, doctors were worshipped. Okay. Now, because of this accessibility to so much of information, okay, which is not even true. Okay. We don't even know if half the information is true. But we rely on this particular information so much that when you come to a doctor, or, when someone comes to a doctor, there is a lot of questioning with what you have already read. So why is it not like this? Why is it not this? Why is it not like this? Okay. So there is only so much that a doctor can prove by writing. Okay. The only way that you can prove yourself is again by making you do the test and, letting you know that, this is nothing that you feared. This is something that which we have already told. So the thing about doctors is now doctors have also taken a setback, like, the risk taking. Okay. Risk taking has come down a little because of the attacks doctors face. Like, irrespective of what it is. Yeah, they face a lot of attacks. Like, even I think probably 6 months back, there was a thing where a child passed away because tooth was taken. Was the news. Wow. Okay, but that was not what happened. The child had to undergo general anesthesia. The child already was neurologically compromised. The child had gone into desaturation. Okay. Tooth extraction was not the reason that the child died.
Wow.
But that was how it was portrayed. Okay. So what happens is, then obviously doctors will be like, oh my God, then I better not do this, because if anything happens, then they're going to come at me. That is why actually the equation has changed. You understood?
So what
it's quite sad.
So what can people, like anxious people out there, so like as a person, if I'm going to consult a doctor, I'm going to do my research, because it's available. Like, there's nothing stopping anybody to do. So what can we as people who go to doctors do to help doctors? So what can we do? Like, do we challenge less, or like what can we do to help?
So something which I tell the people who come to see me is also, if there's an anxious patient, I would ask them, I will give them my medical opinion. I ask them to take second opinions also. You can take second opinions from other doctors also. Okay. And choose what is right for you. You do not just believe one person. Because I myself recommend to my patients, please go and take a second opinion from elsewhere.
Yeah,
that will help in one way.
Yeah, definitely. So yeah, that's interesting. So like, if we covered a little bit of your profession, now I think let's move on to some topic which I think I'm like so glad you're here to talk about. So you mentioned this earlier. So you went through your low phase and then something changed. What was it? Or what changed?
So I got introduced to gym. Okay. I got introduced to gym in the most weirdest way. Like I told you, my brother and sister-in-law, they were just married, newlywed couples. So as part of their couple goals, they started going to the gym. So my sister-in-law very casually told, why don't you try gym? I have never tried gym my entire life. I have been a dancer. I perform dance, but nothing of the physical activity. So casually, and I have this thing where, maybe because of how the way I am, either I'm not there, I'm all in. That's my nature. Okay. So I went into the gym telling I'm already paying for 3 months of membership. I did not even do a trial. I just went all in. Okay. And I started going to the gym, and it became a regular thing. And something inside me changed. Like, my anxiety started coming down. Okay. And I was able to, I would say I was able to focus my anxious energy to pushing more weights. You get it? That's how the equation changed. And I understood the importance of bringing in discipline to my life. And a routine to my life. And I have been conscious about the way I eat, the way, the way I by introducing gym into my life, a lot of other things just fell into place. Just like that. And it is like, there is a breathing technique when you pull weights, like if you know about gym. So that breathing technique itself is so calming. That was the biggest game changer for me.
Okay, can you give what do you do? What is the breathing technique?
Like, so every time you push or pull weights, okay, you have to breathe in, you engage into the muscle, and then you push out. Okay. When your muscles are engaged and when you're lifting, you hold the breath, and when you're pulling the weight, you release it. That's how it is. So initially when I started doing, when I went into gym, I had no idea about this breathing technique or, muscle-mind connection or nothing of that sort. I went in, even I was not even able to do a squat properly. I went in with a knee injury because of my dance history. I have a Kathakali history and a dance history. And then I also used to play badminton, so I had a tennis elbow also. So I went into the gym with injuries, and then slowly, like, initially it was just like, lifting the weights for someone else. It was like that. But I used to go. It was a routine that I built. Then slowly I started getting something called as a muscle-mind connection. Basically, when you do a particular workout, you go into the muscle. Your head should be inside the muscle that you're engaging. Okay, and you feel it. You feel it in every rep that you do. That is called a muscle-mind connection. Only after developing that, I could, understand how workout went. And it was in between this that I understood about breathing technique also. So I never knew about when you should breathe in, when you should breathe out. This was also something that I slowly developed because of the routine, developing the routine of going to the gym.
Yeah. Like, that's amazing. I just want to take a moment there just to say, gym also was a big challenge for me. I had to overcome like gym anxiety. So it's called gym intimidation. I don't know if you know about this. It's called gym intimidation. It affects, I think, more men than women, but the gym intimidation is like the men feel very small in the gym when compared to other men because they're all lifting more. But this is all just anyway a psychological thing. So I was very scared of going to gym. I didn't even lift weights at all. I used to do the usual gym routine, just go walk for 25 minutes, run for 20 minutes, and then come back. I used to be like a treadmill jockey. I used to just go treadmill, and think that is a workout. Instead, I should have just gone for a walk. That would have been same effect.
Yeah.
But strength training, I want to pick up on because not a lot of women do strength training, especially from South Asian cultures, especially from our culture. Why is that?
There is this very wrong concept, first of all, body image. Okay. Even gym intimidation is something which we also have because women are supposed to look a certain way. Okay, they're supposed to look skinny. Okay, they're not supposed to look bulky. Okay, and also that, gym should help you reduce weight. That's it. There is nothing else gym can do. That's the concept. So anybody who walks into the gym, okay, even in my gym also, the receptionist was like, so madam, how much do you want to lose in so many months? I'm like, I did not even come here and tell you that I want to lose weight. Did I come and tell you that I want to lose weight?
Wow, that is body shaming straight up front.
Yeah. But it was my trainer who came and asked me, ma'am, what is it that you're looking for from a gym? I mean, what is it that you want to do? So I told her I wanted to build some muscle. I wanted to be strong in myself, like, feel strong in my skin. That's it. Okay. And he's
just on that. So why did you feel like you wanted to be strong, and why did you feel like you wanted to build muscle? Is it something? Why?
So initially I went into a gym with an anxiety issue. Okay. And I wanted to feel good about myself, because I was so anxiety driven that the episodes used to come at least 4 or 5 times a week. Okay. And it was really taking toll on me. So I heard somewhere that, you start working on, it will create a change. That's when I went in.
Okay.
And then there was something about weights, which really, what do you say? See, it's like you're challenging yourself every day. Okay. You're setting a record for yourself, and you're going to break your own record every single day. And what we don't understand, I feel, especially in our culture, in our South Asian culture, men and women, they have the same skeletal structure. Okay. They have the same anatomy, they have the same muscles. The only thing different is the male and female organs and hormones. When we get this in our head, I think all of us, all women will start doing strength training or, weight training. And women have this fear that, they are going to look muscular. But let me just tell you, women have to work really hard to look muscular, because we don't have the hormones that men are blessed with testosterone.
Yeah.
We have so much testosterone, so which is going to take a lot more effort for us to build at least some muscle.
Yeah.
And we need it more, actually. Women need it more because, see, our hormones protect us till we are menopausal. The moment we hit menopause, all our hormones are going to leave us. Okay. Slowly, osteoporosis will set in. Osteoporosis, basically, you're going to start getting, your bone is going to leach out calcium. Your bone needs to be steady, doing its work. You need to train the muscles around it, because your muscles are slowly going to strengthen your bones. It is very, very... My knee pain just dissolved like this. I can do 100 kg squat now. And I started off with not even a single squat.
Yeah. Yeah, I've seen your progress. It's really amazing. I think everybody should check your progress out. That's so amazing. But the question comes back that the women treat strength training so differently, and men treat it in another way. That's another topic.
Yeah.
But men is like a bit more different. But I feel it. So what is your suggestion for anyone who says, "Oh no, you can't lift weights. Women shouldn't lift weights"? What is your response to that? So like people say, women shouldn't be lifting weights because they are this. Like, how do you respond? I'm sure there are so many people who say that. That's why I'm saying it.
Oh, I was a lot of men who were intimidated by the weights I lift in the gym. But then, so I cut out all the outside noises. And I keep telling even my trainer also, when my trainer says, maybe you should be motivated by this or that, I'm like, I feel like I am my biggest motivation. The journey that I've gone through, okay, the journey that I'm in now, okay. And I told you, every day, it's not about me beating someone else. It's about me beating my ex, myself, how I was before. And there is this very weird concept that, when we work out, we should sweat. Okay. We just sweat and sweat and sweat and be out of breath. So a lot of people believe that only when that happens, they have worked out.
Yeah, that's another.
That is completely different. Yeah. That's a completely different thing. That's why people always go back to cardio. Okay, cardio means treadmill.
Because it feels like you've done work.
I have done something. Yeah. That's not it. When you're doing cardio, I agree cardio helps. Okay. But it's like, let's say you are having biryani today. An example. You do cardio, you can burn your biryani very well. But you're going to end up eating one more biryani. You understood? Huh?
Yeah.
Strength training is nothing like that. You don't have to sweat oodles and oodles and oodles when you're doing strength training. You get into your muscle, you get more concentration. It's a form of meditation. Like for me, I love it so much that, when I'm inside, like let's say I'm doing a lateral pull down. Okay. When I'm doing a lateral pull down, I'm already inside my lat muscles. So when I'm pulling, there is nothing else. It's just me, my lats and my breath. It's a form of meditation. If you see, your mind is fully there. So what more do you need?
So what is your advice for any women and also men in terms of strength training? How do they get started? What is your advice? What should they do?
One thing is, you need to find a good trainer. Okay, I was blessed, and I'm still blessed that I have a trainer. Okay, his name is Amar. And he has helped me through this journey. There are days you get demotivated. Myself also. I also get demotivated. And I'm a woman. Okay, I have monthly menstruals. And I know and I have understood that about my body, that 100% before menstruals, the week before menstruals, I'm going to be weak physically. I will not be able to pull the weights I used to pull. But I need to be patient with my body. Be constantly, love your body, be patient with your body, stop stressing your body so much. Okay. Understand that women get bloating. That's another thing. We are so focused on the weight. We are so focused on the number on the weighing scale. Okay. There is nothing beyond that. Like even if you are bloating and you're in your premenstrual phase, you're stuck on the number on the scale. That's not it. Women are going to gain weight during the premenstrual phase because of the water retention. Understand all that part about your body and then treat it with respect. Slowly start weight training with a good trainer. Okay. And train to understand how to train, not to, I never had a preset goal of, I should be losing weight or anything. I only went into a goal of, I hope my anxiety gets addressed. That was it. Okay. But other than, anxiety got addressed, I started loving the process of weight training. I started loving about how it helped my body, how I gained more strength. You have to understand and love the process. Very important. Otherwise, you will keep hating it. Like if you're going to consider it as a job, it is going to remain a job.
Yeah, that is so true. So, like, there are some misconceptions. Let's bust some misconceptions. I want your opinion as a doctor and as a fitness enthusiast. Does lifting weights affect women and their and their hormones and their anything? Is there any downside of lifting weights for women?
So basically, females also have this hormone called as testosterone. Okay. So the testosterone on each female is what governs how much of muscles they can develop, like how little muscle they can develop. Okay. So when you start weight training, automatically your testosterone levels will become higher. That's normal. Okay. But if a woman has conditions such as PCOD, PCOS, like polycystic ovary disease and symptoms of that, they have to address the hormonal therapy first. Okay. But just because of that, weight training will not affect their diseases. Okay. But I always I have a protein shake, which I have after my workout. So I always include flax seeds and chia seeds and cinnamon and all, which will counteract this increase in testosterone. That is so that it doesn't go too high. And I have not had any irregularities in any of my menses because I have been weight training. And in fact, during my weight training, like, I agree there are women with different thresholds of pain. Okay, they get pain and all that during the periods time. But I have always worked out during all my period days. It helped me, actually. Like, when you're doing that, your pain reduces and the flow increases, which is actually quite good for you. Okay, this is one thing. And another thing which I want, like I told you, I want female to understand is that the fluctuations in weight that you're going to see. Okay, women often get disheartened because of that. You know, they see a little weight gain during that time and then they become all haywire. Oh, I have started gaining weight. No, that is completely fine. This is the biggest myth I have always broken with every woman who has walked into my gym. You know, who come and who check the scale every single day.
Yeah, that's a very, I don't know where it came. Like, of course, it's a lot of media and things like that. Yes. There's another question, which is, weightlifting will make women less feminine. Is that's like a stereotype, right? Like, that's what people think. Like, if you lift weights, you look
bulky.
You don't look like, the most sexist comment is like, if you lift weights, you don't look like a woman. That, I mean, that is so pervasive and so bad. That's why that's why a lot of women don't even attempt it, because they think like, oh, the society will be like, oh, you have too many muscles, you're like a, I don't know what.
No. And you know, there is this you know, US actress, oh my god, I'm not getting her name. There was I lost her name. Naomi, African American. Like, she did a movie, Queen King or something like that.
Naomi and Zonzi. No.
I'm not very sure. Okay, let's just take Black Panther for that. Black Panther. I'm just going to talk about Black Panther.
Yes.
Okay, the women in that. Okay.
Yes.
Man, do they look masculine to you?
No.
They're shredded. Have you seen their muscles? They do not look masculine. They look toned. Okay. And it's a very weird concept that, you know, women will look masculine if they start weight training, because they cannot look masculine. Maybe our posture will be better. Like, see, if you're a person who's used to slouching, okay, you're going to be erect. Okay. That's the major difference that I've seen in people who have started training. Like, you know, they will carry their posture very well, and which I think is a good thing.
Yeah.
Otherwise, I don't think that, you know, a female will start looking more masculine because of weight training.
Yeah.
It's their physique. Like, you know, if your bone and your body structure is going to be a certain way, that may not change. Like, I know I'm a broad shoulder person. Okay. So the muscles which are attached to my bones is going to be the same way itself. My shoulders are not going to shrink down because that is a skeletal base. But that shouldn't be the judge of, you know, you're going to be masculine or not. If I have a friend of mine who works out with me. Okay, her name is Nandita. She lifts same weights as I do. You wouldn't believe her structure. Okay, she lifts the same weights like how I do. But she looks like, you know, she is very slim and, you know, very toned. Okay, not as broad as I am. That's the skeletal structure. So you can never change a person's skeletal structure.
Yeah.
About how that is. Only the muscles around it is going to be better. That's it. Otherwise, you are not going to look masculine.
Yeah. You got it. I think is it Lupita and Nyong'o? Is that who you're thinking of?
Yeah. No, not Lupita Nyong'o. No. She is the Oscar winner, right?
Yeah.
Not Lupita Nyong'o.
She's
I loved her. The figure in the King.
Which one? King?
She female king something. Queen. I went to watch that movie only to see her perform. Like, you know, oh, I'm not getting it.
What is the movie called? Wing?
I'm not getting the name. That's what.
Is it Black King or something like that, right?
Black Woman King. Black Woman King. Oh my God. The women in those movies, they have worked out like crazy.
The Woman King.
Like,
just the Woman King.
Yeah, the Woman King. Yeah. They have worked out like crazy. Like, I have seen this movie and I have gone back only to check their workout routine.
So that is the point. So like everybody is different, and everybody reacts to strength training differently, but it's very important because it keeps the bones intact. It helps you with your mental health. It helps you go through life not happily, like in the best way possible. So strength training is important, and I think we should all do it a lot. So yeah, that has inspired. I hope that has inspired a lot of people because this is very important. And if anybody is keen, those who might be listening, is keen to see what Parvathy does, should check it out. Like, you should go to Parvathy's Instagram. I mean, it's amazing. What she lifts is amazing. And it's inspiring also. Not just for women, it's all men. Like, I am inspired. So yeah, it's wonderful. Thank you for sharing that.
No, but now, South Asian culture, now a lot of women have also gotten into weight training. Like, there are a lot of, famous personalities like Nitya Neelapad, one Pooja Bhatt. Okay. Pooja Bhatt is a power lifter. She just recently broke the record. She lifted 197 deadlift, conventional deadlift. Yeah, she is amazing. And she's another person who I look up to, who is so, who's so for weight training in women, and, how it has helped. And, she's explained a lot. A lot of people get into this for wrong reasons, like, not understanding it.
Yeah, and a lot of people get in there just to aesthetics, just want to get that Instagram picture, and then forget about all the things they did. And this is why I'm not a big fan of these fad diets, or like get 6-pack in like 7 days.
I do not believe
it can be done, but it's just not sustainable.
Yeah, there are so many advertisements of in 30 days like this. You cannot do anything in 30 days. What you do after 30 days? It is not going to sustain for 20 years. So you have to do something which is going to sustain for 20 years.
Yeah.
That is why I don't believe in, showcasing your results every now and then. You do the work every day. You put in the work every single day consistently. Consistency is the golden word in life. Like, let it be discipline, let it be routine, let it be about learning, let it be about relearning new things, let it be about gym. It is the golden word. Like, no matter what pitfall I've had, like, even if it's a bad mental health day or a bad physical health day, I always go back to the gym. I always go back to my routine. I do not break the routine. I do not break the routine because I know what I'm capable of when the routine is not there. I know how dark I can be when the routine is not there. So I have been there, and I don't want to feel that ever again. So I stick to the routine. I stick to being accountable.
Got it. You mentioned, this is fascinating because I can just keep listening to this all day. You mentioned something. How do you safeguard from, so now that strength training is a big part of you, how do you safeguard yourself from anxiety of the gym, or gym anxiety? Not going to the gym, but what happens if I told you, doctor, you can't go for the gym for the next 20 days? Will that affect you mentally?
Yes. Like, recently I was very ill, and I was diagnosed with dengue, and then they were like, please doctor, stay away from the gym for at least 1 week. that was difficult for me. Okay. And the thing is that when I go back, so that's where I'm very kind to myself. Okay. I'm very kind to myself. I allow rest. Okay. When I go back, I don't jump into, oh my God, I cannot lift weights like how I used to lift. Okay. When your body goes through a physical decline, 100% it will affect the way you perform. Okay. So I'm always kind to myself that way. Like even if I'm not able to attend the gym for 1 week, okay, I might compensate by probably going for a walk or, trying to do something. I have weights at home also. So not going strenuously heavy, but, still keep on moving my muscle. That's about it. That's what I do.
Because if you don't use it, you lose it, basically.
Yes.
And then you have to find it again.
Yeah. And what you talk about gym anxiety, it's very true. Okay.
Yeah.
Why I'm telling this is because I have a lot of peers and friends who have gym anxiety, but I try not to get it to my head. But I also go through anxiety because recently I have been trying to learn pull-ups. Okay. I have not been able to do a pull-up till now. Push-ups and all I can do, but I have been struggling with pull-ups for quite some time now. So there again, it's learning. Okay, it's something new that I'm learning now. Okay, so there are certain things that I have to break. Some of my learning patterns that I have to break. Okay, so there also initially when I started training for pull-ups, I was becoming very anxious because the normal techniques were not helping me. So I went into Instagram. I started checking techniques about how I can do pull-ups. Okay, which will help me. And then I discussed with my trainer. Okay, I was like, listen, I'm getting a little anxious, I have to learn this. So I also get gym anxiety. Even now I have that. But then again, I'm kind to myself. I do not beat myself up because I have all tendency to beat myself up. Okay. So I do not beat myself up. Every time I feel like doing that, I keep telling myself, you have gone through a very different life cycle. Okay. A very different life. Your journey. You have come through or, gone through all this not to give up for something like this. Okay. You're going to fight this through. So I have grit over here and gratitude over here in my tattoo.
Well, that's nice.
So these are the two mottos I believe in. I'm very thankful about what my body has gone through. I told you, all the suicidal tendencies and all that. So I'm very thankful that, my body has taken me through all that and put me here. Okay, I'm still having this body. So I'm thankful and grateful for that. And I also have the grit to still work on it. So I don't beat myself up. Like today I'm not able to do, but I will keep trying. I'm going to keep trying. Like I have a PR, like if I set a PR for my deadlift or squat, I don't go back the next week and try to break another PR. No. I work on myself every day. I do the work consistently and then only I will go to set my PR like that. So I also have gym anxiety, but I always make it a point that my competition is only myself. Okay. I do not look at, okay, this person has done so much, this person has done so much. No. Because I have friends who do that in gym. Like, oh, today you could lift 120. I couldn't lift 120. I'm like, what the hell? It's not a competition.
You're lifting 100 anyway. Like, what is it different?
Yeah.
You're lifting so much already. It's ridiculous. Yeah, anyway, I get that also. I mean, I also get that. And for me, it's a different journey. I am, because of my ADD, and I don't want to use ADD as an excuse or anything. I'm just saying the tendencies I've noticed is I go jump into something a lot and then I get so excited and I do it for a certain period of time. And then there is a cool off period for 2 months, 3 months, I don't even do anything. So what I do is I go to the gym, 3 months, I'll be like, yeah, loving it. Personal record, I'm enjoying it. And then for 3 months, I wouldn't even go to the gym. And same with other things in my life, even work, even things which I like. It's like very sporadic. So I do a lot of things, stop. And that stopping phase is where you said about kindness, grit, and gratitude is through my mindfulness and like through my practices, through learning about mind and body. I'm able to manage this phase. I'm like compassionate to myself. I'm like, okay, this 3 months, no, don't worry. Don't even go to the gym. Do something else. So that's why I play cricket or like do something. And previously, I used to go to the gym thinking, oh, I'm not good at anything. But then what happened, which is also flip side, when I started to do well, when I started to do things which I never thought I could do, like I was like, wow, I'm doing 36 kilogram dumbbell push. I'm like, what? This never happened in my life, like 40 years of my life. And then I get the other end of gym, which is the nastier aspect, is like the superiority complex. I don't know if you like that aspect nobody talks about in the gym. Like when you start to do well, you're like, look at me. Oh my God, look at how good I am. And that is affecting me as well. So like that was a new thing. It's just like, oh, I feel like I'm better than people. That is so pervasive in thinking. That is even worse than the other one, which is more about to do with the self-worth. This is going to another stage of and anxiety is that feeling of like, oh, look at me. And that is also happening in a lot of people, and nobody talks about that. So I just wanted to ask you, do you have that, or do you feel sometimes you're like, oh, look at me, I don't want to say it, but like I'm better than certain people, but it's all in our minds, right? It's all in our minds.
Yeah. So the thing about that is, so I have people who come to me asking, are you training for powerlifting? Are you an athlete? Because of how my body looks or how much of weights I lift. Okay. So in those moments, I'm like, nice, like that. But then again, what keeps me grounded is my own body. Because menstruals, periods, the monthly ones, which comes, what happens then is your physical strength will come down. Your mood will go down. Okay. So I always know in my head that, yeah, today I could do 200 kg leg press, but you put me on the same seat 1 week before my menstruals, I won't be even able to lift 140. Okay. So I feel like that part keeps me grounded. Like I know that if I don't work on it consistently, I will lose the strength. So even if I get those glimpses of, okay, but my body always keeps me grounded because I know there are days where I'm not strong. I know there are days where I cannot even, pull a normal. So that's how and it is very, very important that we keep ourselves grounded. Okay, because when my tennis elbow happened, I was not able to do deadlifts for almost 3 months. That took a toll on me because everyone around me was doing, and then I was stuck to doing other things, and I was doing strengthening of muscles. What made me happiest was my video of deadlift, okay, before my injury and after injury and strength training, that is strengthening each muscles, okay. It was completely different. One is a struggled lift. After my strengthening, after the injury, after strengthening, the lift was so simple. It was like a cakewalk lift. So that's when I understood the importance of, understanding your body and giving it the rest it wants, giving it slow training when it needs. Sometimes I only end up doing stretches and, doing only strengthenings. That is physiotherapy strengthening. Okay. I would only do that because that is also important.
Yeah.
So it is there. It is there, but you have to keep yourselves grounded. You have
grounded. Yes. Yeah. True. And as I always say, like, if we go like in the sky and think this is you're better than everyone else, the life will show you one day you are not. And so like my point is, acknowledge that. Yes, the progress you have made, acknowledge it. Give yourself a high five. Don't have to give anybody else a high five. Just, the progress you've shown is amazing. Keep going. That's the kind of message. Yeah. And these thoughts will come naturally. These thoughts will come. Like when you do something wonderful, you're always thinking, oh, look at me. This is human nature. We are always looking for survival. So, but it's fascinating. I think we can carry on talking forever, but I think we'll call it part 1, and then we can carry on. This has been really wonderful. I think I want to talk more about the next time we catch up, more about the self-care and like routines and how we can help bring awareness to mental health in our cultures, in our society. So by society, I mean like in South Asian and like for us. So I wanted to explore that a little bit, but I think for now we'll park it. We're done.
Yes.
So just before we go, I want to ask you one question. If you had one resource, and only one resource, one self-help idea, topic, book, what would it be? Just one thing.
So
it could be a book. It could be
I was just like,
it's not. I'm just saying, any one self-help topic you would pick. What is the one self-help topic you would?
I always tell this to people. You have to be accountable for yourself. About you have to be accountable about your actions, your decisions. Okay. See, I agree. We all have made a bad decision then. Okay, you can keep telling life was unfair to me, but now it's in your hands. It's your choice to make it what it is, to make it what you want it to be.
Yeah.
So that is one thing I always go to. Then when I'm upset and I'm sad and I'm too, I'm like, I cannot do this, I go to gratitude. Like, I count my blessings and I name them one by one. Okay, it can be anything and everything. Even me sitting here in this room is a blessing. So I name it one by one. I keep writing it down, journaling. I keep writing it down. Okay, I'm thankful for this. I'm thankful for this. And the more your gratitude towards, the more keeps coming to you. Okay, there is this abundance in this world which is just flowing and flowing and flowing, and I just wish people were more thankful. Like instead of sitting and complaining, first you look at your blessings. Like today you're sitting and complaining, like today I'm ill, I'm not able to go to work. I'm not going to sit and say, oh, I'm ill, I'm not going to go to work. I'm going to, okay, today I have a day for myself. I'm thankful for that day. Okay, probably I can do so many good things with this day. Be thankful for the rest also that you get. Be thankful for the injuries. Be thankful for the lessons. Okay, if a patient is going to come and yell at me for something, there is a lesson behind it. Suppose a procedure got cancelled. Okay, there is something to be thankful for it. Probably God was trying to do something, or the universe was trying to, realign something for you.
So thank you for joining me on Me, My Self-Help and I. Thank you. Thank you, Parvathy, for your time and your effort. And let's catch up again. Appreciate it.
Thank you, Chad. Yes.
Pleasure.
Okay, so we'll see you soon.